My name is Jessica Agrela, and I'm currently completing my thesis under the supervision of Dr. David Priest, and I'm profiling positive and negative emotion regulation abilities across affective disorder symptoms. Now, emotion regulation is the ability to modify and manage our emotions across the three channels of the emotional system, as well as knowing when it's appropriate to regulate your emotions. Now, emotion regulation is conceptually relevant to understanding affective disorder symptoms such as depression, anxiety, and mania. However, majority of the research tends to focus solely on how we regulate negative emotions, often disregarding how we regulate positive. So therefore, my research wanted to determine if positive emotion regulation abilities account for significant unique variance in affective disorder symptoms beyond negative, and to map what profiles of emotion regulation abilities characterize these affective disorder symptoms, that being depression, anxiety, and mania. So I did start off with some hierarchical regressions. So for depression, anxiety, and mania symptoms, positive emotion regulation ability did account for significant unique variance in all three, which was nice to see. And I also did a latent profile analysis, which is what you can see here. So what that is an analysis that categorizes people into profiles based on their patterns of data. So everyone who completed my study can fit into one of these general four patterns. If you look at the y-axis, the 0 represents the mean score for all these variables, with the 1 being one standard deviation above the mean and -1 being one standard deviation below the mean. So scores that are above 0 indicate elevated levels of affective disorder symptoms or elevated levels of emotion regulation difficulties in these facets. I want to draw your attention to the two profiles at the top, the purple and the blue. So both these profiles have elevated levels in anxiety and depression symptoms. However, they're regulating their emotions quite differently. So the blue profile has the highest difficulties in these negative emotion regulation abilities. However, with positive, their scores are fluctuating around the mean, so they're doing quite well. Alternatively, the purple group also has difficulties in these negative emotion regulation facets, but they're also having elevated and the most extreme difficulties with positive emotions, as you can see at the end here, which is quite interesting to see. And it's also important to note that we didn't see anything going on with mania, which is most likely due to the fact that we did have a community sample. So the implications of this, it highlights the importance of positive emotion regulation ability in affective disorder symptoms. It also helps clinicians to understand and conceptualize these symptoms, indicating that both positive and negative valence domains should be considered in the assessment and treatment of these disorders. It provides insight into the use of transdiagnostic approaches, where, for example, in the analysis, we didn't see two distinct profiles of anxiety versus depression, indicating there's a large overlap of emotion regulation difficulties, and perhaps the same transdiagnostic approaches could be used across affective disorder symptoms. I would recommend for future research to conduct this with a clinical population to see if there's any key differences or similarities between them. Thank you.